Overtraining. Overtraining has been a topic of great interest over the past decade. Overtraining can be defined as excessive frequency, volume, or intensity of training resulting in fatigue, which is due also to a lack of proper rest and recovery. Overtraining itself is simple. The stimulus, overtraining syndrome, is the condition resulting from overtraining. It is sometimes referred to as staleness. This syndrome can, but does not always, include a plateau or decrease in performance. Many alternative terms have been suggested for overtraining, including burnout, chronic overwork, physical overstrain, and overfatigue. Some authorities use the term overtraining only when a decline in performance occurs. Overtraining can occur on a short-term basis, which is now termed overreaching. Recovery from this condition is easily achieved within a few days. Consequently, overreaching is often a planned phase of many training programs. However, overreaching can be considered the first stage of overtraining syndrome. The following progression illustrates the overtraining continuum. Overtraining stimulus leads to acute fatigue, leads to overreaching, leads to overtraining. Overtraining syndrome can last as long as 6 months, and recovery may not be immediate. In the worst case, overtraining can ruin a career. The athlete never recovers from the mistake made in training. This is especially true for aerobic endurance overtraining. In resistance training, long-term decrements have not been demonstrated, and many athletes rebound after a period of recovery. Since we now know that such rebounds are possible, it is difficult to determine when overtraining becomes chronically detrimental. In addition, some athletes respond to overreaching, whereas others do not. In many athletes, the problem is typically too much too soon, or too much repetitive overuse, which results in injury. Overtraining can cause dramatic performance decreases in athletes and of all training levels, but the training mistakes may be quite different. Overtraining can cause dramatic performance decreases in athletes of all training levels and is caused by mistakes in the training program. Overtraining syndrome involves alterations to a number of physiological systems. Two distinct types of overtraining syndromes have been suggested: sympathetic and parasympathetic syndromes. The sympathetic overtraining syndrome includes increased sympathetic activity at rest, whereas the parasympathetic overtraining syndrome includes increased parasympathetic activity at rest and with exercise. One or both can result from overtraining. Some researchers feel that a sympathetic syndrome develops before the parasympathetic syndrome and predominates in younger athletes who train for speed or power, though few data exist to support this differentiation. All overtraining can eventually result in the parasympathetic syndrome. Injury or illness can also result from overtraining. Overtraining in anaerobic strength and power athletes. Strength and power overtraining is a problem that arises when mistakes are made in the acute training program variables that define the exercise stimuli for the workout. A theoretical overview of overtraining and anaerobic activities is shown on Table 8.4. When appropriate, workouts are repeated over time. Overtraining syndrome is possible. A performance plateau well below an athlete's theoretical genetic potential can also indicate an overtraining syndrome, in addition to the classic profile of performance decrease. A difficult training program might intentionally create a decrease in performance to allow a rebound in performance to take place. This concept has been called overreaching or supercompensation. If training mistakes are made due to the athlete's or coach's miscalculations, a depression in performance can continue for weeks or months, and the athlete is often considered to have overtraining syndrome. The use of overtraining is a higher risk training approach and requires understanding the training stimuli and timing of the rebound. This is vital to its success. In elite competitions, small performance increases can make the difference between the gold medal and 100th place. Thus, the high-stakes game of training for elite performance requires even more careful planning than training for fitness and health. The most common mistake made in training is the rate of progression. If mechanical and chemical loads are created that damage the fundamental structures involved in the adaptations, examples, increased muscle size required for improved performance, overtraining can occur rapidly. For example, a shot putter performs a supplementary speed workout by sprinting both the straightaways and turns on a small indoor cement track. Such a workout can place high shearing forces on the muscles that connective tissue of the lower legs, resulting in tremendous stress and damage. The damage of vital structures results in a decrease in shot putting performance. Thus, overtraining could arise from mistakes in supplemental training. Sources of overtraining must be examined, both sport-specific, resistance training programs for strength and power athletes, and non-sport-specific training modalities. Examples, run training for strength and power athletes. Only a few studies have examined various types of overtraining models in the laboratory. The intentional, improper programming needs to create a chronic decrement in performance is not easily accomplished in the laboratory environment. Tracking studies of athletes and training may be needed to document overtraining mistakes and effects. However, to systematically study the overtraining and overreaching phenomena, both approaches are needed. A study by Callister et al. First demonstrated that anaerobic overtraining may present a different set of symptoms than aerobic endurance overtraining. The investigators in this study increased the volume of resistance training, run training, and practice in the U.S. national level judo athletes over a 6-week program. These investigators observed significant decreases in performance in a set of 300-meter sprint performances times and decreases in isokinetic force production. Furthermore, the resistance training performed was not effective in enhancing maximum strength, 1 RM performances, but the expected increases in resting heart rate and blood pressure, Halter monitored, did not occur. A study by Fry et al. Also made it obvious that rest and recovery periods are related to intensity-specific overtraining. After warming up, recreationally strength-trained athletes performed 8 sets of machine squats at 95% of 1 RM. In this protocol, Sunday was a rest day after 6 days of overtraining. The study could not force a reduction in the 1 RM performance. What did result were non-specific performance decrements in isolated knee joint isokinetic torque production at 60% degrees per second, increases in sprint times, and increases in agility speed. All decreased performances. The investigators found that a body preserves the high force production of the 1 RM and that 1 day of rest appears to enhance tolerance of a overtraining protocol. Yet the decrements in peripheral performance serve as a caution that something was still negatively affecting by the overtraining protocol. Thus, athletes and coaches and sports scientists should examine the athlete's peripheral as well as global performance abilities to ensure that overtraining in just one performance parameter does not occur. A decrease in performance in sports and isokinetic torque production may not be important for a powerlifter, but they could cause a concern for a football player. In a subsequent study by Fry et al., the 1 day of rest was eliminated in the overtraining protocol, and after warming up, each subject lifted 10 sets of their 1 RM with rest between sets. This resulted in a significant decrease, greater than 9.9 pound or 4.5 kilograms, in the 1 RM in 73% of the subjects. It is interesting that 23% of the subjects' 1 RM decreased less than 9.9 pounds or 4.5 kilograms. And some were still making progress and not yet in an overtraining state. This demonstrated that the time course of an overtraining condition greatly depends on the individual response and genetic endowment, while follow-up was not done to determine whether this protocol constituted overtraining or just overreaching. It was apparent that intensity overtraining would be difficult to carry on for an extended periods due to the localized stress in the thigh musculature and knee joint. This study showed that a relatively low volume exercise stress, but one with a high, greater than 100% relative intensity without any day of rest, can result in dramatic performance decrements in both nonspecific test variables, isokinetic knee extension, peak torque sprints, and training mode specific variables.